It's always been a dream of mine to volunteer in Africa. It's just something I've always wanted to do since I first started nursing school. So the opportunity never really came to fruition over the years, and then I just happened to get the email last spring saying, "Are you interested in nursing in Rwanda?" And then when I found out the details about it and how it's all about improving patient comfort over there.
When Elsa asked if I would become involved, I knew that she had already formed relationships and she had a great deal of trust within the nursing community in both Butare at the hospital and in Kigali at the Health Institute there. She's well respected and she has many friends within the country as well. So that gave us a very good foundation from which to start to develop our partnership.
One of the reasons that I really felt that the partnership had the potential to work was the response of the healthcare workers to the students when they were there. The students, one of the things that they did was provide ongoing education sessions, and there was such incredible enthusiasm about this, and there was such a desire to make the quality of care better that it just made me think about the healthcare workers in Nova Scotia and how kind they are, and I just felt that it would be a perfect partnership to have people come from Nova Scotia to work with the nurses and enhance the quality of the care.
Most of the feedback I got from people was, one or two things. One was like, "You're going where? And why are you going to Rwanda?" So they basically thought that I was not. I could probably go on a Caribbean cruise for 3 weeks, or someplace hot and sunny that had a little different focus. Or I had folks say, "Wow, this is really going to be a life-changing experience."
When I was first thinking about going, I was trying to think, well, what can I offer? What can I do? And so I just thought, as a musician, I could do some music with the people there, and I just started with that idea. I was just really hoping that I'd be able to make a difference over there in the amount of time we were going. I just was open to anything that was going to happen, but I was very excited about what was going to happen, even though I didn't know.
The most significant challenge that we faced at the hospital was the language. I don't speak French, and I felt that was a real difficulty in communicating with staff. Certainly, they were appreciative of our efforts to communicate, and they were extremely tolerant and supportive in trying to communicate with us, and they were certainly equally as challenged using the English language. So the language barrier, for sure, was the biggest challenge for us, especially in mental health, where it's all about talking.
One of the ICU nurses said to me, I think half jokingly, but he said that the African was born to suffer. And his name was Richard, and I said, Richard, do you really believe that? Are you serious? He said he was serious. But if you read the history of Africa and Central Africa, it's really true. They have suffered for the last 400 years, largely at the hands of the West, the Western powers. And so when you look at the larger picture, you can understand why they have not been able to develop what we've developed, because they've had to contend with war and slavery and civil war and genocide, whereas we in Canada have had the luxury of not having to deal with any of that stuff. So we could develop our excellent system from the grassroots and improve it over the years to the point now where it works, and it works well for
I think
everyone.
once we slowed the pace down and they recognized that we were there as a resource for them, not to show, you know, what we have and how we could make life better, you know, then the reception was absolutely over. I mean, they're just the most hospitable, wonderful people. They really are.
Yeah, they were very supportive of all of that, so we didn't feel any extra expectations. They were very grateful for all of the work that we had done to prepare. They were very grateful for all the supplies that we brought. So I felt that they were happy to see us and really happy to be able to expand our support to them through a partnership.
It'd be easy, I think, to come away from a situation such as we encountered and think, why don't people do more, or why don't they work harder, or why aren't they more interested in improvement? And because the challenges are immense. They have a lot of high tech, but they do not have basic public health. And high tech without basic public health is it just doesn't work. It's bad for people. I did a presentation on palliative care because Lynn was gone, and they seemed very interested, and they had questions, very basic questions. A question, for example, that I think we've gone past it here. What's the difference between palliative care and euthanasia? So they were, wanting to know more and wanting to learn. So we came away with the idea that probably the palliative care field is a reasonable and a good thing to focus on in the partnership of caring. We've talked a number of times in the group that we have to focus on the small gains. If you look at the big picture, you'd come away and shake your head and say, nothing is ever going to change in Africa. There's too much stacked against it. But when you deal with individual cases, such as we did, and you see how much joy it brings to people, really, to have someone interested in them and help them with pain and bring them food and that kind of thing, then it has to be doing some good. And I think from a medical ethics standpoint, to think that there are so many people dying from treatable diseases that could be treated so cheaply by our standards. I mean, that's a crime, and we have the resource to do that, and we should be doing it. But if you don't see it, it doesn't strike you. You don't connect with it.
I must say that I experienced, even though it's a short period of time, I've experienced an awareness that I can't put it really into words, but it's almost like a heightened sense of awareness and priorities. My priorities have changed, and I see that as I go back to work, and everyday practice that has totally changed, and I can't explain it. I cannot put that into words that would capture that emotion.
I am totally thrilled and excited with the response to the Partnership in Caring and the group that went to Rwanda. I'm just so excited with what they were able to accomplish in the short time they were there. And the key thing was the building of the relationships and the trust between the members of the partnership and the people that they were working with. And it was phenomenal. In just a very short while, they were able to introduce major concepts such as palliative care, and the response was really positive.
The message that I'd like to share about a partnership in caring is that this type of experience is truly life-affirming. You step out of your comfort zone. At times, we were each out of our comfort zone, and these were the times that we drew on each other for strength and support.
I think it's an absolutely great cause, and I think the benefits are immediate, and I think nothing but good can come out of joining the group, being a part of the group, and coming with us to Rwanda.
People understand that this is where they want, the direction they want to go in the care in their institution, and they see this partnership as a pathway, and I think it will only grow stronger as time goes on.
There's a bond, a trust that it's palpable, and that trust in the goodness of people, regardless of our culture or what we have. It's human beings connecting on a level that's really sacred. And I think that Partnership in Caring has discovered that, and that's the fuel that will keep that organization going. And it's a really wonderful initiative.
Mwana wa